Hello everyone, welcome to Eben Health. This is Davis, and today we want to discuss what is a stroke. But before we begin, hit that subscribe button and that like button. They help me go a long way. Now, I want to first describe the types of stroke. There are two, and when you understand them, you almost understand the causes. Ischemic stroke is whereby the blood flow to the brain is occluded. This stops the oxygen from going to the brain and to the nutrients. And it's the most common cause of stroke. It's usually caused by things like blood clots. Then there's what they call hemorrhagic stroke. A hemorrhagic stroke happens when there's a leakage and this causes blood to flow into the brain. When this happens, it increases the pressure on the brain tissues, thus damaging them. So this is the second type of stroke, which is caused by things like trauma and aneurysms and things like that. Now, stroke is very simple to identify. Usually, a person has what you would call focal deficits. Sometimes you see you lose strength in one arm or in the whole leg. If it's you can find someone maybe they have lost strength, they can no longer move their arm. That's what someone will call paralysis. Some people have like one face falling, or one side of the face falling, but it does not affect the eyes. Uh, then also you have things like convulsions, you have things like severe headache, especially if there is hemorrhage. So those are the signs of the stroke. The most common cause of stroke is hypertension. Hypertension is defined as having your blood pressure above 140 over 90 millimeters of mercury. Have you seen people where they put the blood pressure cuff and measure those numbers the doctor writes? That is the blood pressure. Now, if any of those numbers is above any of what I've said, even if one of them is low, we consider that hypertension. You can call that systolic if it's above 140, or diastolic if it's above 90. So some people you find that the upper number is okay, but the lower one is high, but still the doctor says that you have diastolic hypertension, which has its own causes also. So the doctor will still say that you have hypertension. So when you have hypertension, this leads to damage of the blood vessels, and therefore there's a higher chance of them do bursting or getting blood clots. The main cause of a stroke is usually trauma. That is, when someone hits you in the head, you fall off a border, you're playing football and you hit yourselves. At times, something can happen to the blood vessels which predisposes them either to form a blood clot